Hello, PsychU community, and welcome to today's webinar, The Role of the Pharmacist in the Treatment of Depression. Thank you all so much for joining us. My name is Aneta Fornal, and I'm with Otsuka Field Medical Affairs. I will serve as the moderator for today's exciting discussion featuring our topic experts, Dr. Megan Ehret and Dr. Richard Silvia. Before we begin, I wanted to remind the listeners that the presentation is sponsored by Otsuka Pharmaceutical Development and Commercialization Incorporated, OPDC, and Lumbeck LLC, committed supporters of the mental health treatment community. And our speakers are paid consultants for OPDC. Given today's topic, we are also reminded of the suicide prevention hotline, which is 1-800-273-TALK, as well as the crisis text line, 741-741. We can now move into the objectives for today's program, and those are to describe the significance of depression for our patients and where and how depression is treated, discuss different ways that pharmacists can assist in the treatment of patients with depression in any practice setting, and provide additional resources for pharmacists regarding depression treatment. Before we jump into the content, I also wanted to remind our audience that should you have any questions throughout today's presentation, we welcome you to type those into the chat. So with that, let's go ahead and get started. And I'm going to start off with you, Dr. Silvia. So looking at the prevalence of depression, during the past year, we have heard so much regarding mental health and specifically about depression as an illness that affects so many. So why is depression such a concern for our patients that we as pharmacists really need to think about?
So thank you, Aneta, for that question and for the warm introduction. And welcome to all of our participants listening in today. So as we know, depression is not a new illness. This has been around for many, many years. And had we recorded this session a year and a half or so ago, this would still be a very relevant topic. But as we know, over the past year with the COVID-19 pandemic, the rates of mental illness, in particular depression, anxiety, suicidal ideation, have increased because of the social isolation that many individuals feel. So we see here on the screen a number of statistics. And one thing I do want to point out is all of these statistics are pre-COVID. So in today's setting, all of these numbers, if we were to measure them today, and there are people who are doing that, I'm sure, these numbers would likely be higher. So when we say 8% of American adults in a given year, that's a given typical normal year. That incidence would likely be much higher today. We know that it is a prevalent illness. It is one of the more common reasons why patients present to care in different settings, be that primary care or psychiatric mental health care, or even emergency care, depending on the severity of the illness. So we see, again, 63.8% reported severe impairment. So this is an illness that affects functionality, their ability to do the daily activities that we all do on a regular basis. So it's something that our patients present with, and it's something that walks into our practice settings, whether that's a community pharmacy, an outpatient clinic, an inpatient facility. So as we're interacting with our patients and we see that they're on these medications that are used to treat depression, we should be considering what we can do, considering how common of an illness this is, the impact that it has on their lives, and the impact that it can have on their other illnesses, such as their medical health, medical illnesses, diabetes, hypertension, asthma, etc. So it's not just the depression that can affect them, it's the impact that it has on the entire patient and their overall health, not just their mental health. It's something that, like I said, patients present with, and it's a common reason for them to do so. So we almost need to expect, especially in the COVID-19 pandemic world, that we have folks walking in with this, and we need to be prepared to help them as healthcare professionals, part of the team.
Excellent. And Dr. Silvia, whether we look pre-COVID, post-COVID, I think these numbers are certainly some, staggering statistics here, right? It's clear that depression is common, it's costly, and it's catastrophic. And one of the things we also see on the slide here is that, it may be one of the most common diagnoses that we see in psychiatric practice, but it's also a very common diagnosis that we also see in primary care setting, right? Certainly leading to a lot of disability worldwide. So thank you for that commentary. Turn the question here to Dr. Ehret, thinking about the role of pharmacists across various settings, right? We know that pharmacists have tremendous interactions, right, with patients with depressions. There are so many different roles that pharmacists can play in assisting patients along their treatment journey. So, Dr. Ehret, could you please speak to some of the roles that pharmacists play in the treatment of patients with depression specifically?
Thank you, Aneta. I think one of the stats that shocked me the most on the previous slide was the 8 years from presentation or onset of symptoms to actual treatment or presentation to some sort of provider. And I think this slide encompasses a role that pharmacists can play to hopefully shorten that time in helping to identify patients earlier and provide them with various treatment options. And pharmacists, as we all know, practice in so many different settings. Rick and I practice in completely different settings. Same sort of positions in life, but very different, unique practice settings. You could be in a mental health clinic. You could be providing that direct patient care. You're the ones engaging with the patient. You may be prescribing medications. You may be there in a consultation role to other mental health providers. So you're seeing more of the treatment refractory patients or offering information on drug interaction or side effects, but also engaging in patient education surrounding depression. We're going to learn a lot today about primary care and Rick's role that he has played in primary care, but that may also be a setting where, as a pharmacist, you're being asked to consult on mental health medications to primary care providers whose time is very limited. In particular now, as there is more of this, that there may be a lack of comfortability with some of this, and so they may go to the pharmacist for help with those medications. Again, there's a lot of monitoring of adverse effects from the mental health medications and education to patients that can be done there. Many of us practice in community pharmacy, so our role may not be the direct patient care there, but we play a very important role in education. This is the first time that patients may be receiving these, and so we are providing a lot of that education about the medications. We may be the first call for an adverse effect because we're there more hours of the day or 24 hours a day in some cases. So we will be monitoring for those and providing recommendations or advice on that. But we're also there as an adherence check. We know that many people discontinue medications very quickly, and so we can be there to help facilitate many of the unique aspects of adherence that we have now, blister packs, monitoring, all of these different refills, text, apps, all kinds of things that community pharmacists play a role in. And we'll talk throughout the webinar today about some of the other things that community pharmacists may play a role in as well. So I think there are just so many things that pharmacy can jump in, and hopefully within these roles, we're engaging patients to hopefully decrease that time to treatment.